Whenever you're ready. That was a big one.
Whew! Oh, that one was way stronger than the last one.
There it goes. There it goes.
Yeah, I felt that.
That was a good pop. So we have Oliver back. It's 2 days later from your first cranial facial release. How's it going?
Really good. I'm sleeping better, and my nasal breathing, especially during like intensive cardio, so much better.
Okay.
So much better.
Tell us the condition that you have called Chiari Malformation, and what does that mean, and how did it affect you?
So
when did you get diagnosed?
So 3 years ago, it's like you can be born with it or you can develop it over time. More likely than not, you're born with it. It's very rare that it becomes something that develops. But I was diagnosed 3 years ago with a specialty brain malformation called Chiari, and it basically means that your cerebellum, which is the lowest part of your brain on the back side, herniates towards your spinal cord because your brain is bigger than your skull, so it needs to find a place to go. And it chooses to go down because that's the only opening it has.
It shifted down.
Yeah, exactly.
So his cerebellum slips through the foramen magnum, right?
Yeah, exactly.
Which is the foramen magnum means large opening in Latin. Magnum is large and the foramen is opening. And so it slips through, but then it puts pressure on your spinal cord, it puts pressure on your brain.
Your nerves, it can misalign your atlas.
So I'm not going to adjust his neck because my style of adjusting is contraindicated for what he does. He does get adjusted from a atlas orthogonal specialist that with minute little incremental adjustments can adjust the top bone, and that's been fantastic for you.
It's been a game changer.
So that's really good. So he wouldn't be a good neck case for me, but we're going to do the cranial facial release. And I was just talking to him before. We broke it down into 2 categories of symptoms so we can have a little bit of tracking or reference point. One was, we said, just pure breathing ability. What percentage change have you had in just the ability to gain air and exhale air?
Definitely like 60 to 75% for sure with the nasal breathing.
Improvement?
Yeah, definitely. And then with the pressure in my head, like 10 to 20% gain, but I feel like it's going to go up as I continue to keep this consistent.
Okay, so the second one would be more from the Chiari, and that would be that cranial facial pressure from having
restricted
that disruption.
cerebral spinal fluid, yeah.
And there, he knows it better than me, so this is great. Let's get you... Oh, and we might even look at your TMJ today.
Yeah, definitely.
Okay. Which side is worse?
It's it's looser here and it's way tighter on this side.
Okay. So I'm going to actually have you start on your back. Okay.
For sure.
I'm going to just do one little opening on your thoracics to keep that rolling.
Okay.
So scoot down, scoot down, scoot down. And then I'm going to spend the time on your cranial facial release and your TMJ today.
Sounds good.
So those looking for a full body adjustment, we're not going to see so much of that today. But you felt some of those, right?
Yeah.
So scoot down towards me, and we'll do an upper 1-2, which is just upper back. There we go.
Yeah, I felt that.
That was a good pop. Lie on your side facing me. We'll keep the lower back loose.
Okay.
Remember, I'm not going to go above T1 because that's not a good idea for my style of chiropractic. I could probably do a very light activator tap on a C1, but since he's with such a specialist, I wouldn't just let him go there for that. There it goes. Come to the other side. And bend the knee up.
Okay.
And then this one goes straight. Okay, lie on your back. So that one didn't pop that side. Wanted to comment on something. So now I'm not going to adjust your neck. I'm just touching your face,
for sure.
okay? Which is a lot of people say, oh, I cracked my boyfriend's back, or somebody in a bar goes, yeah, there's this guy that when I go out drinking, cracks everybody's neck in the bar.
Mm-hmm.
You know, what do I think of that? Well, I think it's like playing Russian roulette.
I agree 100%.
Because maybe, like this guy, you're 22?
22 years old.
So
yeah.
he's a big, strapping, athletic-looking guy. And until he was 19, he didn't know he had a Chiari Malformation where his skull and his upper cervicals are compromised. So imagine he's drinking a beer in college at a bar and somebody grabs his neck and cracks it for him. In his case, that could have killed him. So
that's not dramatic.
and that's not dramatic. Yeah. That's true, right?
Mm-hmm. Yeah.
So yeah, it's all fun to crack bones and stuff, but you know what you guys don't know is that sometimes I don't crack. I ask people anything I should know about, and he says, "Yeah, I have this thing." And remember, the first thing we said was, "Therefore, we will not be adjusting your neck."
Mm-hmm. You should always leave things like that to a professional, 100%.
Yeah, it's all fun until you hurt someone, right?
Exactly.
Like, oh, that was cute. I just got my back cracked at that bar by that drunk guy. That's fun. But maybe it isn't fun. Maybe it's not fun because you have an underlying issue that you never knew about and now you're paralyzed or dead.
Mm-hmm.
So this left side is definitely tighter, right?
Yeah.
That's the tight side.
Mm-hmm.
So what I'm going to do, open your mouth just a little bit. And I'm under here, under the maxillary bone. And I don't want to pull too much because this would be a long axial rip where you're just doing too much of a torque. So I'm going to come closer to the joint itself, which is harder work for me because I have to have stronger hands. See, if I come all the way out here, I have more leverage and can really rip, but I'll also injure him. So I'm going to come in to the gap and pull apart with just my fingertips, which doesn't put undue risk for damaging his jaw. You know, that should feel good in a way. Like it hurts, but
Hurts so good.
it's probably something you've been craving, right?
Yeah, definitely.
Like craving. Can someone just stretch that for me? Now, I have really strong fingertips, so I am getting a really good stretch here.
Oh, I feel it.
And you're wondering why don't I come down and get the whole lever? But even with how confident I am of working with the body all these years, I could just crack that thing the wrong way if I grabbed his chin as the lever. So I'm coming up really close to here, and this is the proper place to work it. Again, someone that with no training, they're like, well, I could just crack anything because I watch it on YouTube. You know, I guess you could, but do you know what you're doing? And what if you hurt someone? Whew. It was a lot, right?
No, yeah, for sure. But I think that was exactly like the kind of thing that I needed, and I think it's like an overtime. You know, nothing happens overnight for sure, but that felt good.
It doesn't look like much, but wasn't that a lot of pull?
Oh yeah, it was intense.
So now we're going to do a little tap with this light instrument.
Okay.
And it'll be along the plane of opening.
Gotcha.
So we're going to pick the vector or the angular force line that improves it by coming down along the axial plane. So you're going to open your mouth just a little bit, and I'm going to come at a very nice angle to give it a little bit more. Then there's another place all the way under here. Here, I'll do it to myself so you see that. I don't know why I feel like I have to do it to myself. I'm going to come up really high, and there you go. No, I'm joking. It wasn't bad. And I'm coming in here. Now open your mouth. It should be easier.
Yeah, it is.
Not bad, right?
Mm-hmm. It's way less tight. It's still uneven, but that's just because it's nothing's going to happen right away. But it feels more even than it was prior for sure.
Let me check this. Do you want to do another layer? It's a little more intense.
We could try. Yeah,
Okay.
why not?
So I'm going to put these gloves on. And this is kind of cool stuff. Actually, this move I learned by the same. I learned from Dr. Adam Del Torto, who was the guy that taught me cranial facial release, and he likes to get inside and move the jaw quite a bit also, because over the years he worked with a lot of CFR clients, but he also worked with a lot of TMJ. Now I've worked with TMJ, but not as much as him. But I'm gonna just kind of go
from the inside, right?
Yeah, but I want to do the upper part first, okay?
Sure.
So I'm gonna not go inside the mouth, but in between the gum and the tooth, if that's okay.
Yeah,
So,
no, I've had similar.
yeah, so I know how to do all that type of stuff. So I'm gonna come in here and grab here and grab here. So now I'm just under the lip, but my fingers aren't in his mouth. They're between the teeth, on top of the gum, and I'm gonna turn it like a jar handle. So first I'm gonna pull towards me, and you can feel that stretch, right? And let me brace it on the other side to get a nice pull. And you feel it, right?
Mm-hmm.
And now let me grab it from the top. And this time I'm gonna go the other way. And I'm gonna come back my way again. Good. I'm working now the jaw against the upper part of the maxillary. Good. Now I'm gonna come in. Now I am gonna go in a little bit and grab that spot deep in here. Here, see if you can peer in. So I'm gonna go deep in there, and that's not a fun spot for him. That should hurt.
Oh yeah.
And I'm gonna try to get some motion there. Some stretch. Good. And now on this side too. Okay, that's
Way tighter on that side.
Yeah. Now open your mouth and close. Good. Open even more. Good. All right.
Whew.
So, here's a couple of tissues.
Gotcha.
Grab as many as you want, and then hand me the box back. And you'll have more in a minute, but
Yeah,
just
for
to
sure.
get started with. If you don't mind, I'd like you to hold on a floppy just to give you some of the squeeze.
Of course.
It's a perfect squeezing aid. And floppy is skilled in this work. All right, we're going to start on the right side, like we did last time, but I'm going to go for a different chamber this time.
All right.
Okay, here we go. And I did. I got the upper, which is hard to get, but I was able to get it.
Woo.
Whenever you're ready. That was a big one.
Whew. Oh, that one was way stronger than the last one.
And you could sit up if you need to, or
Maybe for a second. Yeah, that was. You went deep that time.
yeah, I went to the upper chamber. And here, look at me for a second. The upper chamber is really hard to navigate because it turns. Why can't I find my little thing? Here you go. So the upper chamber, you have to go first up 45 degrees, then lift the toothpick, and then come back down again. So it kind of goes like this and then back down. And it's really hard to do that. And I'm getting much better at it because I've done probably over 100. What do you think, Roger?
About 100.
100 now, right? Roger's filming today and we work. So you just get better at stuff, and I'm better at finding that one. But it's a whole different experience.
Oh yeah, no, completely different.
Yeah.
More intense, definitely.
Did you hear crackling or just
It
pressure
was
release?
pressure, like a lot of pressure, and then I kind of felt it come through the other side. Like I think Is that the part that connects to the back of your throat, or?
Yeah, and also, so it definitely goes to the back of the throat. You might have felt your ear. Did you feel any pressure in the ear?
No.
Okay, that's okay.
Yeah.
And then my professor or teacher, Dr. Adam Del Torto, I mention his name a lot because I love to give him credit. You know, and it's interesting, he's been teaching or sharing this for 25 years, and he said a lot of the people he taught never gave him credit. Like, they took the information like they figured it out, and I'm not that way. I mean, to me, I would have never learned this if I didn't study with this guy. And I
would have never known what it is if I didn't watch your YouTube videos. So.
Thank you. And he's retired, and I don't want to, ever make it look like I figured this out. I studied with a really good guy, and I'm grateful. But he was saying that, let's say I just did your right side, but he goes, the right side gets the right side, but it also pushes across into the left. So we already did a little left. Now we'll definitely go do the left.
And the left's my worst breathing side too, so.
But that's why he sometimes likes to start on the side that's less involved, because that kind of warms up. It gets a little bit of the other side indirectly, but then we can now go right at the bad side. It was crazy though, right?
Yeah, no, I thought it was going to be the same as last time, but it was more intense. But the cracking from the first time, like on Wednesday, I think that was like the start, and now like my body's kind of ready for it, so it's less intense overall, but it definitely is like allowing it to kind of be consistent and stay that way.
Good. And that's our goal, is to see how far we can go with this. All right, thanks for people staying with us this long. Now we're going to do the other side, right?
Yeah,
is that good?
Yeah, definitely.
Okay. So take a few tissues.
Can't finish halfway, right?
No, I don't like to.
Yeah, I won't either.
And I think it would be weird too, also, in that it would feel something is incomplete.
It might make the asymmetry a little bit more.
And you don't need any asymmetry in your life.
Yeah. Nobody does.
But I think asymmetry would affect you exponentially. You would get a profound imbalance from an imbalance.
Oh yeah, for sure.
If that makes any sense whatsoever, but all right, so we're gonna do the left side, okay?
Yep.
Here we go. One more. Got it.
Oh man, let the waterworks come. Oh, thank you.
Woo!
It's like new life.
That was crazy, right?
Oh yeah.
So this round was even more intense, don't you?
Oh yeah, definitely.
Did you hear anything that time, or just felt things?
No, it was just feeling. Yeah, I mean, I only heard cracking the first time on the right side, but I mean, this time was definitely more intense. And what I did feel was like, not really a hole, but it was so tight to the point where there was no like air, and I felt like the balloon go past a part that wasn't open, and it like opened up, not like a pop, but like I don't know, there was no sound, but like the feeling of a pop was like there without the sound.
So you got an expansion too.
Expansion, that's the word I'm looking for. Yeah, for sure.
Awesome. I felt that. I mean, that's why I needed 2 pumps too.
Yeah.
So the first pump, I totally depleted the bulb, and it was almost stuck together. It was so depressed and collapsed. And then I even said one more, and I let it let go, and it went.
Yeah.
And then I went.
No, you got it that second
time. And it
time.
went through, and it went bam, and opened up the back and shot through. And it was pretty dramatic.
Yeah, I mean, I usually have to, like, when I have a lot of mucus buildup or, like, sinus irritation going on, I usually have to blow a lot, and it doesn't come out naturally like it should. But, I mean, like, right after this, even on Wednesday, the same feeling. It's like I don't have to tell it to get out. It's just falling the way it should be normally.
So we're seeing some changes. How does your jaw feel right now?
It feels good.
Yeah?
Yeah, definitely.
Good.
It feels a lot more consistent. And the tightness, like, is not really there, but the unevenness is still there. But that's something that'll probably go away over time. Yeah.
Okay.
So.
For people watching this one as their very first cranial facial release, what we're doing is when that balloon goes back in the nose, one of the things that the balloon does is it mobilizes the cranial bones. It releases direct pressure on the brain by having your bones squeezed so tight in your face. It relieves the dural meningeal tension, and the dura is like the sac or sheath on top of our brain and spinal cord. So it releases some of the pressure around that. And think of the casing on a hot dog being too tight. And we sometimes feel that way where, like our brain and our skull is just too tight. It definitely opens breathing passageways. It will facilitate sinus drainage, and some of the people that would come for something like this have breathing problems, migraine headaches, sinusitis, tinnitus, which is the sound in your ears, like the whooshing or ringing, vertigo, Bell's palsy, trigeminal neuralgia, sleep apnea, snoring, head trauma, and it helps a whole bunch of different things for people. But we don't really target curing any disease or ailment. And back to him. So anything you want to say, or are you going to come back and do more?
No, I'll be back next week, definitely.
All right, cool. All right, thank you so much. Whenever you're ready. That was a big one.
Whew! Oh, that one was way stronger than the last one.